The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Good day to you. This is TMD Demystified, and I am Tony Urbanek, and we are gathered here today to talk about and produce our next episode on Dental Town. Today's topic kind of came up out of nothing, out of nowhere today. I hadn't decided what the topic was going to be for this week, and today I had to me what was a very interesting patient, which tripped my interest in doing this topic for this episode. Jillian was her name, and Jillian was a very extremely physically fit young female, very slight, couldn't have been much over 5 feet. Probably didn't weigh much over 100 pounds, maybe 105. And that's part of the story. What we're going to do is we're going to talk about the importance of listening to your patient and learning. Now, I reviewed the other episodes that I did, and I did an episode on listen and learn, which is the point being of that episode was, if you're going to treat TMD and you're going to do it right, one of the first things you need to learn is sit down and listen to your patient's story and your patient's history, because you will learn a lot, and you'll learn more and more as time goes on. And once you get to a point where you have enough basic knowledge of TMD, and of course, I hope you have a lot of basic knowledge of anatomy, physiology, and biochemistry, you will be able to piece together a lot of these pieces that we know as the symptoms of TMD. And today's episode, in the case of Jillian, is a really good example of doing just that. And although it doesn't happen very often, because most of the cases of TMD that I have seen over the past few years, when I say few, certainly aggressively within the past 7 or 8 years, doing 5,000 consultations, are pretty much rote, pretty much routine. You can know what to expect once the patient starts giving you the story. But occasionally you'll run across something that even in the best of experience does not quite make sense until you're able to put the pieces together, connect the dots, and then you can confirm the diagnosis, and then it all makes sense to both you and the patient so that they can get the help they need. So let me give you just a little background on Jillian. Jillian, as I said, is a very physically fit young woman. She has a bachelor's degree and a master's degree in physical therapy, exercise therapy, and works in the Vanderbilt system in one of their clinics. She came in on referral from an ENT, who I give a lot of credit to, because her symptoms did not absolutely ring true on the most likely and the most obvious symptoms that are often seen on TMD patients, which are headache, earache, jaw pain, and neck pain. But these were her symptoms, and I'll kind of go through my list here. Her description, and she did most of it with her fingers rather than words. She said, "This is very hard to explain, but it feels funny, it feels tight, and it feels weird on the side of my faces." Her biggest and most obvious complaint was when she was listening to music on the way to work with her earbuds in her ears. When the earbuds in, it created pain in her ears and made her feel, she didn't use the word dizzy, she said kind of fuzzy, made her feel fuzzy. So strange feelings around the head and neck, kind of this fuzzy feeling when she put the earbuds in. And then on careful questioning, she had an occasional, and a very occasional headache once a month. One headache a month, pretty routinely. That is kind of an unusual presentation for a female who has TMD. So I wasn't sure as I went through the litany of symptoms, and she went down the list, but the more I pressed her on the litany of symptoms, do you have now, currently, recently, or ever had headaches, earaches, jaw pain, neck pain, ringing in the ears, fullness in the ears, vertigo, dizziness, shoulder pain, arm pain, arm tingling, and numbness and locking? She came up with the symptoms that I just described to you. Now, the symptoms, as I've read before, are, and talked about extensively before, are just red flags. Symptoms are red flags. They don't prove anything. They are suspicions. Symptoms make you suspicious that it might be something on a differential diagnosis. And when I finished listening to her nondescript symptoms, I wasn't sure whether, when I did an examination, whether she was going to be positive for TMD or not. I really wasn't. In fact, I was wondering whether I needed to maybe look elsewhere and refer her elsewhere, maybe a neurologist, depending on what I found, but I wasn't quite sure. But when I did the exam, the little exam that I've discussed and described and videotaped for you many times, many different places, and we did this with the mouth open to the closed position with severe, significant pressure within the glenoid fossa from the open and closed position. It definitely elicited pain, but not much. Her numbers were basically 2 out of 10, so it didn't hurt a lot. She did not really complain of that headache once a month. In fact, I had to draw that out of her. The first time I asked her, "Do you have headaches?" she said no. And the examination that I did on the temporomandibular joint is like 2 out of 10. That is not the usual that we get. We get 5 out of 10, 8 out of 10, 9 out of 10, 10 out of 10 if the joint is inflamed. But here is what we figured out. Here's what the actual pathophysiology of Jillian is. And hopefully some of you who are physically fit or exercise routinely will already know about this. This is basic physiology, and that is the effect of endorphins on the immune system, on the neural system, and Jillian, obviously, because of her duties and her bills and her experience with physical exercise therapy, she was extremely good shape, and she exercised a lot, which gave her the advantage of having constant, significant endorphins released. And as hopefully most of you are aware, endorphins will stimulate the opioid receptor sites in the central nervous system, the opioid receptor sites, and opioid receptor sites give the feeling of well-being, but they also give the feeling of decreasing pain. That's why you use opioids for pain, obviously. We've done that in oral surgery and dentistry for better than a century. Endorphins decrease inflammation. Endorphins increase dopamine, which gives you that feeling of well-being. And together, when you have enough of the endorphins secreted, because it's a hormone, it's a series of hormones, throughout the body, then when you have a significant amount of inflammation within this joint, by decreasing inflammation, increasing the effect of endorphins on the opioid receptors, then they're not going to respond the way the normal patient does. I found that, and this is not the first case I've seen of this. This is the most recent case I saw because it was today, but it is not that common. And my point about the episode, and my point about learning and listening is that when you sit down and you actually listen and let the patient speak in their own words, in their own terms, kind of lead them to, for sure, you just want to know about their symptoms, their complaints, what they mean to them, kind of steer them away from what other doctors tell them or told them, or their diagnosis, because that'll get you nowhere. Number one, listening to the patient talk about what other doctors say can lead you on a down rabbit holes that don't go anywhere, and put confusion into it. Once you know the symptoms, once you understand the concept of TMD and the concept of inflammation creating the symptoms, that's really all you need to know. Then you can confirm it with the diagnosis. So you just really want to listen to the patient. And so this is kind of an extension of that episode, I believe it was episode number 17, that I went through what I thought was important to know about listen and learn. But this is a little deeper. This is kind of splitting hairs regarding the concept of listen and learn, because besides just learning the basics of TMD symptoms and the basic of how this affects the patient, patients sometimes come up with some rather unusual presentations, which all boil down to the same thing: inflammation within the joint. And Jillian was a very good example to me, because as I said earlier, when I finished listening to her symptoms and I finished doing my symptom list, I was unsure really whether this was going to lead into my diagnosis of TMD. But of course, when I did get some relative pain elicited on pressing on the joints from an open closed position, plus knowing what she did, which is my routine, I do it for a purpose. I always ask the patient what they do, because if they are doing something in a toxic environment, or they're working 24/7, or they don't work at all of those things have relevance to your differential diagnosis when you listen to the symptoms and try to decide, is this patient going to have, does this patient have TMD, and all the relevant things that go with it. And so it is my routine. And when I asked her what she did, and she said she was a exercise therapist with a bachelor's and a master's degree in those areas, I actually spent a little more time asking her about it, because I didn't quite understand where she worked in the Vanderbilt system and what they were doing. But they have a clinic devoted specifically to physical therapy, exercise therapy, wellness. It's really a wellness clinic, which apparently is well funded, standalone. Vanderbilt has a lot of money for those kinds of things, and more power to them. But I learned about what she did, and then I was able to put two and two together, connect the dots as to, this lady is not going to respond like most women do to the causes of pain regarding inflammation within the temporomandibular joint, because of the most obvious increase in endorphins in this woman's physical day-to-day life. So, in a way, it's a game. It's a game when you're doing a history, when you're doing a physical examination. It's really important to kind of just sit back and let the patient speak and see if you can connect all of the dots that will line up. They will line up one way or another. And occasionally I'll kind of digress a little bit. I've had two significant cases where I thought the dots lined up and this patient had TMD, and the dots did line up. But when the patient did not get better rapidly, when I say rapidly, within the first month, I did further investigation. One patient had trismus, couldn't open fully. The other patient just had significant amount of pain in the right places. And I made the diagnosis with both of those patients. I think I mentioned before, had occult cancers, occult oral pharyngeal cancers that were hidden. And because they didn't respond rapidly, and I did not get the response, even though did the usual modification of the device and the usual things we do. And then I did further investigation and found out that they had occult cancers. So, that's the other extreme. And that is, if once you do arrange the dots and they do lead to a diagnosis, proper diagnosis of TMD under unusual circumstances, don't be afraid to question yourself even further. There are times when you can miss a diagnosis, especially in something like an occult cancer. Fortunately, both of those patients went on to treatment in relatively short order. But Jillian is, I think, a very special case because it led me to do this episode and led me to remind myself and now remind you that there are times when you just really need to, as we used to say in grade school, put your thinking cap on and see if it can make sense to you. If it does not make sense to you, then you need to keep questioning. Don't be so self-assured 100% of the time. If what you see and what you hear does not follow usual and customary, or you cannot make the case, as I did with Jillian, usual and customary, then question it continuously, question it more. Look for other things in your differential diagnosis. Nothing wrong with that. And that's just really good medicine. I have the advantage of being trained in both dentistry and medicine, and dentistry doesn't do a lot about differential diagnosis other than whether the tooth is infected or you have a hot tooth. You do a little differential diagnosis there. But whether it needs that root canal or not, medicine spends a lot more time training their doctors in doing that concept of looking at your symptoms, running up a list of differential diagnoses, ruling them in or out by either different tests or different examinations or more thorough history, things like that. So listen and learn. We're kind of splitting hairs on listening and learn. This is a very unusual case to a point, but I thought I'd bring it to your attention. I hope it's meaningful, that it makes sense to you. Hopefully I always make sense in what I speak about. And when you do enough of this, actually it gets to be fun. It's entertaining to try to challenge yourself when you have one of these cases where not right off the top of the bat, it doesn't really fit all the parameters. Listen and learn. And the more you listen and the more you think about it and the more you know about the basics of anatomy, physiology, biochemistry, pathology, you're able to put the pieces together, connect the dots together, and much more able and willing to take the challenge and to make your proper diagnosis. In this case, we're looking for TMD. With that being said, I encourage comments from listeners. I encourage you to ask questions. I'm always open to questions. If you'd like to communicate with me, it's Tony Urbanik at tmjservices.net. If you'd like to communicate with our Director of Education and Marketing, it's Naomi at tmjservices.net. If you'd like to consider being a network provider for our company, which has developed exclusive and extremely successful method and device for treating TMD. And we have a relatively rapidly expanding network of doctors throughout the United States. We use the device and protocol along the lines that I use it, and I explain to you, both on our online course and in these episodes and podcasts, how you can take the advantage of that for your patients in your practice economically, and for the joy of just treating something that most people think are very, very difficult to treat, which is not very difficult to treat TMD correctly and get rid of these symptoms for millions of patients, mostly females, who have this problem. I am Tony Urbanek. Until next time that I'm able to sit down and present another episode, I look forward to that as soon as possible. Hope you have a very successful week. Thanks for listening.